We will now move then to item 8.2, the labor relations consideration of the ordinance relating to contractor transparency project. Madam City Manager, I know we have a presentation.
Yes, thank you, Mayor, Council members. So I will pass it over to Tiffany Allen, but I did want to take just a minute to really thank her. She's been working day and night and weekends to try to get this together to bring forward in front of you for consideration. Working hard, taking a lot of input, making a lot of friends. A lot of them are out there now. So I'm going to go ahead and hand this over to Tiffany.
Actually, before we do that, we do need to make sure that we're protecting one of our members. And I know Member Chavez, what I'd like to do, being in the healthcare community prior, not as a provider, but I would like to make sure, I know many of the doctors, the individuals that work at the hospitals, they need to get up early tomorrow. So what I'd like to do is bifurcate this item to make sure that we're protecting one of our council members. So what I'd like to do is go ahead and start with the item for 8.2E, which would be specifically only for the healthcare worker minimum wage issue. And Member Chavez, if you have a statement.
Yes, because as many of you know, we do have full-time jobs, and because I have a business position and income related to the healthcare industry, and I am in the process of seeking a formal response from the California Fair Political Practices Commission, the FPPC, and out of an abundance of caution, it is prudent that I recuse myself from this matter until we hear back from the FPPC, which includes stepping away from the dais for item 8.2, Part E tonight.
Member, may you also state your employer's name and your position with them?
Oh, yes. I work for Unicare Systems, Inc., and I am the Binational Affairs and Public Relations for them.
Okay, and we'll wait till the member makes it off the dais, and Member Allen, or Director Allen, or City Manager, I'm promoting you, I think, now, I hope.
I'll be happy to go.
Go ahead and start to provide the presentation.
Assistant City Manager, Tiffany Allen.
The super duper Assistant City Manager.
Thank you, Honorable Mayor and Council. The next item for council discussion is Ordinance E. This is the Healthcare Worker Minimum Wage Ordinance. This item is for discussion purposes only and cannot be acted on tonight. On August 8th, the council directed staff to draft an ordinance modeled on the local initiative on this issue and an ordinance with the City of Los Angeles. And the ordinance before you tonight is responsive to that direction. The ordinance would apply to covered healthcare facilities, which includes all privately owned hospitals, community clinics, health centers, and facilities that are part of an integrated healthcare system. It applies to covered healthcare workers, which is defined as persons whose primary employment is a covered site and that provide or support the provision of health care at that site. The specific job classifications that are included are listed on this slide and include everything from nurses to groundskeepers. Consistent with the local initiative, the draft ordinance would require a $25 minimum wage for all covered healthcare workers effective January 1, 2024, subject to CPI increases annually thereafter. The ordinance also prohibits retaliation and gives the city manager the authority to enforce pursuant to Municipal Code Chapter 1.41, and civil actions are also authorized. With this item tonight, I do also want to take a moment to provide an update on a similar legislative action currently being considered at the state level. That's Senate Bill 525. This bill was approved by the California Senate in May of this year and will go to a vote on the Assembly floor this Thursday. The bill is widely expected to pass and to be signed into law by the governor, which would happen no later than October 14th. There are a number of amendments being made to this bill in Sacramento right now, but my understanding of the current version of the bill would provide for a phasing in of a new healthcare worker minimum wage with various tiers for different facility types. Based on tier, healthcare workers will receive between $18 and $23 per hour effective June 1, 2024. Pay will increase to $25 per hour at different rates for each tier, with all covered employees getting to $25 per hour between June 2026 and June 2033. If signed into law, Senate Bill 525 would void all local ordinances adopted after September 6th of this year and preempt any earlier ordinances until January of 2034. With that, staff is requesting feedback on the draft healthcare worker minimum wage ordinance and recommending that as a next step, staff report back at the next council meeting on progress with SB 525 at the state level. And that concludes staff's presentation on ordinance E. Thank you.
Thank you. Madam Clerk, if we could go ahead and start with the public speakers.
Yes, we have about 50 speakers on this item, and quite a few of them are group presentations.
If we could start with the group presentations first.
Okay. Our first group presentation will be Debbie Espy, and she's also speaking on behalf of Nancy Gringold. We'll allow 10 minutes.
Good evening, Honorable Mayor, Honorable Deputy Mayor, and Honorable City Council members. I am Debbie Espy, a proud South Bay community member. I was born and raised here in the South County and raised my children here, and I own property here in the city of Chula Vista as well. I am the chair of the South County Economic Development Committee, or Council. I am an executive board member of the Asian Business Association of San Diego, and I am the chair of Sharp Chula Vista Medical Center. On behalf of Sharp Chula Vista Medical Center and its board of directors, I thank you for the opportunity to provide public comment. Tonight, recognizing that SB 525 is under review at this time, but I urge you, if we go forward with this ordinance, I urge that we take a deliberative approach when considering the proposed health care minimum wage ordinance. And I request that the council first conduct an independent economic impact report to allow you and the community to fully assess the potential outcomes of such a measure. As you know, that Sharp Chula Vista Medical Center is a vital community asset as both the largest employer and the largest provider of healthcare services in Chula Vista. Caring for the people of Chula Vista and the surrounding communities is the core of what we do and is clearly spelled out in our mission, and that's to improve the health of those we serve. Now, due to ever-rising costs and decreasing revenues, Sharp Chula Vista has operated at a significant loss for more than 5 years. In fact, this year, Sharp Chula Vista's operating loss will exceed $70 million. We're at a freestanding hospital without the financial support of the larger Sharp healthcare system, which itself is facing unprecedented economic challenges. Our hospital would not have survived this long. As the board chair, I'm excited about the plans and investment for the future of Sharp Chula Vista, but the significant increase in expenses outlined in the proposed ordinance would threaten both the future plans as well as existing healthcare services and programs at Sharp Chula Vista Medical Center. And this is not a hyperbole. The reality is that passage of a $25 per hour minimum wage in Chula Vista would cost Sharp Chula Vista $15.6 million in annual unbudgeted expenses. That means this money to cover this increase just simply does not exist. This expense would compound the financial challenges that are already facing Sharp Chula Vista, and decimate the finances of other healthcare providers like community physicians, skilled nursing facilities, and community clinics, all of which would be forced to raise their rates to retain staff. The Sharp Chula Vista Medical Center Board is responsible for the fiscal health of the hospital, and in the absence of additional revenues, we will be faced with some difficult decisions, including program reductions and service closures. Again, this is not a hyperbole, but actual decisions that will have to be made. There is no mechanism that exists for us to increase revenue to cover these and other losses. Statewide analysis shows that any mandated increase in the healthcare minimum wage would exceed $8 billion annually and be passed down to residents through increases in health insurance premiums and copays. But the increased costs and impacts will not be limited to healthcare. In my role at South County EDC and the Asian Business Association of San Diego, I can tell you confidently that a shrinking or reduced healthcare presence in the community is not a good indicator for new businesses or those seeking to relocate to Chula Vista. In addition, current Chula Vista businesses would face increased expenses, which would create a ripple effect across the community. Businesses will be forced to pay more for labor to keep pace with healthcare worker pay. To survive, businesses will have to slash staff and increase the price of goods and services to customers and consumers. So if approved, this ordinance will negatively impact healthcare programs and services that this community needs and deserves, but it will also have a negative impact beyond healthcare that could put at risk the broader economic trajectory of the city and its residents. Good intentions sometimes result in unintended consequences. I urge you to undertake a fiscal impact report to ensure a comprehensive understanding of how this ordinance would impact Chula Vista, and I thank you for your consideration.
Our next group presentation will be by Gabriela Malagon Maldonado, also speaking on behalf of Sergio Martinez.
Good evening, Honorable Mayor, Honorable Deputy Mayor, and Honorable City Council members. As mentioned, my name is Gabriela Malagon Maldonado. I'm the Chief Nursing Officer and Vice President of Patient Care Services at Sharp Chula Vista Medical Center. I'm also a proud Chula Vista resident. I live in District 1. I'm honored to serve my community in this capacity as a frontline healthcare leader at Sharp Chula Vista Medical Center. On behalf of Sharp, thank you for the opportunity to speak on behalf of the draft healthcare minimum wage ordinance on today's agenda. I ask that before taking action on this ordinance, as was mentioned, the City Council undertake a third-party economic impact study to ensure a comprehensive understanding of the ramifications of this minimum wage and how it will impact the city as well as the economic development, the healthcare industry, and most importantly, the impact it will have on the people and the communities of Chula Vista. I just want to be clear that Sharp's comments and concerns about this ordinance are about ensuring that the healthcare access, services, and the programs that we provide here in Chula Vista can continue. This is not an unwillingness to pay our staff more. As a matter of fact, Sharp is committed to paying equitable living wages and compensation to our staff, and our recent wage adjustments, which was less than a year ago, included a system-wide $20 an hour minimum wage and other staff investments that reflect that commitment. We are a people-oriented organization. We're a nonprofit organization. We only take care of our patients from the community, but also first take care of our team members. And we understand that we have to take care of our team members in order for that to happen. We've always put our people first by ensuring they're paid equitably for the incredible work that they do each and every day. Most recently, we made the increase in that minimum wage, but we also gave across-the-board increases for all staff members and made equity adjustments in various areas. Beyond these visible increases, there is what is termed the hidden paycheck, such as tuition-free education, educational reimbursement up to close to $5,250 each year for every employee. That is a significant and immediate benefit for employees and their household budgets, and it also provides a career advancement over the longer term. In full transparency, I was a recipient of such programs, and it wasn't for those types of programs that allowed me the opportunity, which I started as a nursing assistant, to move forward into the capacity where I am now, that wouldn't have been possible. SHARP is proud to serve as a community safety net provider. Considering that nearly 4 out of every 5 patients at SHARP Chula Vista has Medicare or Medi-Cal coverage, but their reimbursement does not cover the cost of care that we provide. As was mentioned, unlike other industries, healthcare providers cannot simply raise reimbursement rates to cover additional costs, as we know that rates are set by government payers or as part of the long-term contracts with insurance companies. For example, over the last 12 months, SHARP Chula Vista Medical Center cared for 57,878 patients with Medi-Cal coverage and spent over $202 million on their care. But Medi-Cal only paid $126 million. That resulted in a $76 million loss to SHARP Chula Vista Medical Center. And that is only the loss due to low Medi-Cal reimbursement rates. The other important fact to take in consideration for SHARP Chula Vista Medical Center is that we are a border hospital. And what that means is that we share border days with Scripps Chula Vista. So we take a lot of unfunded patients that come to our hospitals from the border. There's no quick fix for this, and I understand that. And operating at ever-increasing losses is simply, as you can imagine, not sustainable. There is not a deficit that we can kick down the road and hope that we can pay later. The expenses we face come with due dates, with the largest coming in the form of paychecks to our employees every 2 weeks. We are proud to care for the people and the patients here at SHARP Chula Vista Medical Center. It is part of our mission. SHARP is the largest provider of care for Chula Vista residents, but that single sentence doesn't even tell the story. I mentioned to some of the council members that in 2020, SHARP Chula Vista proudly opened our Ocean View Tower, which opened more than 100 beds to our community just 2 months after we received our first COVID patients. And after that, we were, as you all know, hit with COVID as having the largest number of COVID patients in the South Bay. We saved, if it wasn't for that tower, we would have lost thousands of lives. It's no secret that Chula Vista and South Bay was disproportionately impacted by the pandemic, but we are proud that Chula Vista was there. The Ocean View Tower was able to provide life-saving care right here for the community. We were also on the front, leading the way to vaccination efforts here in the South Bay. When the COVID-19 vaccine, of course, was approved, our staff partnered with community leaders and organizations to do outreach and education regarding vaccine safety and effectiveness. This is just part of the Chula Vista story. This is the work that we do, and we want to be able to continue to do this work here in Chula Vista. We know that each person on the SHARP team is vital to the work and care we provide then and now, and every person and every position is essential, which is why we raised that system minimum wage to $20 an hour last year, and we remain committed to increasing that rate. We just ask that it be done in a thoughtful, approachable way, and the way to do that is to have that impact study. Thank you very much.
Our next group speaker is Patricia Oliveras de los Lobos, also speaking on behalf of Chris Howard.
Good evening, Honorable Mayor, Honorable Deputy Mayor, City Council members, and City Manager and City staff. My name is Patricia Alvarez, and I'm a longtime president and community leader here in Chula Vista, and I'm proud to be a member of the Sharp Chula Vista Medical Center Board of Directors. I am thankful to speak with you today about the proposed ordinance to set a healthcare minimum wage. Before taking council action on this important issue, I urge you to instead direct the city staff to conduct an independent fiscal impact report, which will ensure a comprehensive analysis of the true impact of the ordinance. I am very concerned that the impacts of such a rapid increase in cost to the healthcare industry will be passed along to patients and the community throughout increased insurance premiums and co-pays, or offset by cuts to healthcare services in Chula Vista. These impacts will most certainly deepen inequities and access to care for our most disadvantaged communities. Sharp Chula Vista Medical Care Center is a vital asset in our community. They are the largest employer and the largest provider of healthcare services. In fact, more than half of the babies born to Chula Vista residents are born at Sharp Chula Vista each year. And one of every 3 Chula Vista residents gets care from Sharp Chula Vista Medical Center. But you may know that Sharp Chula Vista Medical Center has operated at a significant loss more than 5 years. This year, Sharp Chula Vista Medical Center is projected to lose nearly $70 million in operations. This proposed council ordinance will compound Sharp Chula Vista Medical Center's financial challenges, resulting in an additional $15.6 million in unbudgeted expenses without any revenues or funds to cover these costs. More than 80% of Sharp Chula Vista Medical Center patients are insured through Medi-Cal or Medicare. These programs do not cover the actual cost of care provided by Sharp Chula Vista, and without additional reimbursements, residents will be negatively impacted through increased insurance premiums or reductions in healthcare services and programs in the community, or both. And fewer healthcare services in Chula Vista means that residents will have to face increased transportation costs to access the affected healthcare services at other hospitals and providers outside the South Bay. Please, do not move forward without a full analysis that considers the far-reaching impacts of these proposed ordinance on Chula Vista residents and their access to care. I urge you to please conduct an economic impact report to ensure that you, as council, and the people of Chula Vista can fully understand how this ordinance can affect our precious community. Thank you so much for your attention.
Our next group speaker is Dr. Smith, who is also speaking on behalf of Scott Evans.
Good evening, Mayor John McCann, and actually all the council members, as well as the deputy mayor, and all of you here tonight. As an emergency physician, I'm going to be direct and hopefully very fast. So, my name is Andre Smith Favela, and I am a physician, emergency physician, and I'm the medical director at Sharp Chula Vista Emergency Department. I've been there for over 25 years. I immigrated with my family from Tijuana, and actually I went to Hilltop High School, so I'm a local. My parents live here. I live here as well. So this is my community. There's a Public Policy Institute, the Public Policy Institute of California has called the emergency departments the safety net of the safety net. And it's a perfect description of what we do every day at Sharp Chula Vista. Last year, we took care of almost 80,000 patients that came in with a variety of different things, from a cold to a heart attack. But that's our role, and that's what we do in our community. And we do it with a big heart, and we basically do it regardless of the way of pay. We, like it was mentioned before, we were involved in the pandemic, and one thing that I would say is when this came, we reacted right away. We started to put tents within the hospital, and actually we looked for every single space that was allowable for us to take care of patients related to COVID. I can tell you that at Sharp Chula Vista, we had the highest number of COVID patients during the pandemic here locally in San Diego. We have been involved, like it was mentioned before, also with the vaccination program, and many activities that we've done throughout our, to help and support our community as healthcare workers. I'm here today to share my concern as a frontline physician over the proposed minimum wage ordinance and the impact it will have in our community. As a physician, I took an oath to do no harm to my patients. Before taking action on this ordinance, I echo my colleagues' concerns and urge the council to instead commission an economic impact study to fully assess the short and long-term effects such as an increase would have on access to care and on the overall financial health of our community. It's so important as an issue, one that can result in possible negative consequences, to not study in greater detail before taking any action. And I get it. We want to do the right thing for our community. And that's why we're all here in different aspects of the healthcare industry to ask you to, again, analyze with more detail. Thank you.
Our next group speaker, our final group speaker is, Layla Cater, who's also speaking on behalf of Rafael Lopez Gomez, Jacqueline Logston, and Shelby Augustus, and she will be allotted 20 minutes.
Good evening, City Council. My name is Layla Cater, and I'm a political organizer for SEIU United Healthcare Workers. We represent over 100,000 healthcare workers in California. I'm here before you today, standing with the workers of our community from local healthcare facilities, clinics, and dialysis clinics. Not only are we here to advocate for a living wage for these workers, but we are also here to advocate to keep our community safe. Before I begin, I'm just going to point out that I think it's comical that we have CEOs sitting behind us that make millions of dollars and workers that make as low as $17 an hour fighting to make ends meet. As the COVID-19 pandemic has progressed over recent years, legislation to increase the minimum wage for healthcare workers has been proposed throughout California. This movement seeks to positively impact the lives of healthcare workers subject to the increase, as well as the quality and availability of healthcare services provided to patients. According to an October 2022 survey conducted by AMN Healthcare, 85% of hospitals, medical groups, some home health providers, and other healthcare facilities are experiencing a shortage of healthcare workers. It has also been reported that 47% of healthcare workers are planning on leaving. This is a huge concern. This is how we protect our communities, by keeping our healthcare workers in their jobs, giving them a living wage, not allowing them to work 2 to 3 jobs and come back to the facility to take care of you, to take care of your family members. A minimum wage ordinance for healthcare workers is aimed at ensuring covered healthcare workers receive an adequate living wage and addressing worker retention challenges in covered facilities, among other purposes. The proposed ordinance would set a minimum wage for covered workers of just $25 an hour. That 25 can change lives. There are a lot of positive impacts for this minimum wage, and I really like us to focus on that. The main objective of minimum wage increases, such as this proposed in Chula Vista, is to raise incomes and improve living standards of low-wage workers while reducing inequality. Minimum wage increases have been shown to result in little to no economic disruption, while also leading to several potential economic benefits. We anticipate that in Chula Vista, the proposed minimum wage would wage increase would reduce job turnover among healthcare workers, especially among lower paid workers like patient care technicians and certified nursing assistants who leave their positions at higher rates than any other occupations in hospital settings. This turnover is costly for businesses and impacts the quality of care that can be provided at facilities where turnover for such positions is high. As a result, covered healthcare facilities and patients stand to benefit from reduced turnover if the proposed minimum wage is implemented. In addition, the healthcare industry is not experiencing full employment since there is not sufficient supply in the labor market of the positions that are short-staffed, especially among lower wage workers. Increasing wages may stimulate supply among workers applying for these positions, thereby addressing the understaffing crisis affecting many healthcare facilities. The proposed minimum wage would serve as a tool to decrease inequality in Chula Vista by closing wage gaps in the healthcare industry, with lower wage healthcare jobs being highly represented by women and workers of color. This could potentially reduce racial and gender wage gaps in the private healthcare sector. Now, we've heard a lot about economic impact tonight. The economic impact of a proposed healthcare minimum wage is happening right now at the state SB 525. And though this differs in scope than the ordinance under consideration here by the City Council, recent analysis conducted by the UC Berkeley Labor Center of the impact of SB 525 is helpful in understanding the need for and likely impact of the proposed Chula Vista ordinance. The UC Labor Center produced 2 reports analyzing the impact of raising wages to $25 for healthcare workers statewide, and some of the most relevant findings to this ordinance I'm going to list off. Number 1, the proposed wage increase would result in substantial benefits to healthcare workers and their families, in particular low-wage healthcare workers. Women and workers of color are disproportionately impacted relative to their average representation in the industry. Workers of color amount for more than 3/4, 76% of affected workers. Affected workers are twice as likely as healthcare workers on average to be in families with incomes below 200% of the federal poverty level. Affected workers are less likely to have access to employer-provided health insurance. In fact, 30.1% do not have employer-provided health insurance, more than 1.5 times the share for all healthcare workers. Almost half, and specifically 48.4% of families with a healthcare worker affected by the proposed minimum wage increase are enrolled in public safety net programs, and raising the healthcare minimum wage would help reduce these working families' need to rely on a public safety net program. And lastly, the estimated percentage change in operating costs for hospitals due to increased payroll is just 1.1%, which does not include the additional savings from increased productivity or reductions in hospitalizations due to the improvements in care quality. At the City of Chula Vista, SEIU UHW does not have access to data showing the total number of workers making less than $25 an hour. But what we can provide are some examples of average hourly rates paid to workers in certain relevant employee classifications. Specifically, the average hourly rate for aides and orderlies reported by Sharp Chula Vista Medical Center is $22.16 an hour in 2022. So you're making $22.16, let's talk about the cost of living. The cost of living for workers in Chula Vista far outpaces minimum wage growth. Raising wages will help workers afford childcare, gas, rent, groceries, and so many other expenses. According to the MIT Living Wage Calculator, the living wage in San Diego County household with 2 working adults and 2 children is $30.80 an hour for each adult. So the average cost of a 1-bedroom apartment in Chula Vista is $2,492, and the average cost of a house is $727,000. For workers earning $22.16 an hour, their salary before taxes equates to roughly $46,000 a year, assuming full-time employment. The annual cost of a 1-bedroom apartment in Chula Vista equates to 65% of their annual salary before taxes. Now, we anticipated claims from the industry that I would like to address. The first is the healthcare industry can't afford a minimum wage. As I mentioned earlier, the estimated cost of a $25 minimum wage to the hospital industry is just 1.1% of operating costs, which doesn't even assume any other cost trade-offs that could net out some of the potential increases, for example, improvements in quality care. The combined net income of all hospitals operating in California was still over $20 billion for 2020 and 2021 combined, and the industry as a whole has ranked over $63 billion in profits from 2017 to 2021. The average California hospital has a net worth of $339 million, and in total, the hospital industry holds roughly $120 billion in net assets. On top of the industry's already substantial wealth, the California governor has recently approved a budget deal to renew the MCO tax, which expired in 2022. The renewed MCO tax is anticipated to generate over $32 billion in state and federal dollars over the next approximately 4 years to $2.7 billion health and workforce investments. California hospitals are due to potentially receive $750 million annually from the MCO tax starting in 2025. In addition, there are one-time funds to support distressed hospitals totaling $350 million, which hospitals can apply to draw down starting in 2023 to 2024. Another claim that we anticipated tonight was exactly what was said. Proposed minimum wage will increase healthcare costs and result in reduced services. Now that's very scary. The first thing that they're going to do is take away access to care from our patients, despite how much, again, in money and assets these CEOs make and that they're investing. California has a healthcare worker shortage that predates the COVID-19 pandemic, and the state made much needed investments to address this in the previous year's budget cycle, specifically $1.3 billion in hospital and nursing home worker retention bonuses and an additional $7 million in clinic workforce stabilization payments. While these efforts are welcome, raising the minimum wage for healthcare workers is necessary to address workforce shortages in the longer term and will also help level the playing field in terms of competition from both within the healthcare sector and outside of it. The high cost of living in Chula Vista is a central reason for the current workforce shortage, and healthcare workers need to be paid a living wage for the industry to stand a chance of retaining these skilled workers. Turnover costs are a source of waste and inefficiency in the healthcare industry, and one that can be reduced by raising the minimum wage for healthcare workers. A recent study found that 38% of healthcare workers are at risk of burnout, and 39% are considering leaving. Industry experts estimate the average cost of turnovers across all occupations in the healthcare industry can range up to 150% of a mid-level employee's salary. For example, the average cost of turnover for a bedside RN is estimated at $46,000. Given the dramatic rise in turnover in 2021, the average hospital lost more than $7 million. The data tells us that decreasing turnover rates should be top of mind for healthcare facilities in order to protect their profits as well as their reputation.
The high cost and inefficiency of contract labor is another cause of high healthcare costs. Hospital CEOs have reported paying $200 or more an hour for travel nurses. Contract nurses' median hourly wages more than doubled from 2019 to 2022, from $64 an hour to $132 an hour. And meanwhile, employed nursing wages increased 11%, from $35 an hour to $39 an hour. It should be noted that these frontline clinical workers, our healthcare workers, are burned out, they are tired, and they are leaving. We have the data to show that, and it is of concern. The first thing that hospitals are planning to do, if the wage was increased to $25 an hour, is take away patient resources. Now, in 2022, SEIU launched efforts in Los Angeles County cities to raise the minimum wage. The same year, city councils in Los Angeles, Downey, and Long Beach passed $25 minimum wage ordinance for healthcare workers, and voters in Inglewood passed a voter initiative in November establishing a $25 per hour minimum wage for workers in covered healthcare facilities. This year, the city of Linwood passed the $25 minimum wage ordinance for healthcare workers. However, apart from Inglewood, where this was passed, there were no closures directly related to the minimum wage increase, and workers have not reaped the benefits of their local ordinances because the same hospitals that cried broke spent millions of dollars referendizing these ordinances. Let me repeat that. We have passed this as an ordinance in multiple cities, and the same hospitals that cried broke spent millions of dollars referendizing this so they could avoid paying their workers a living wage. Now, I'm here today because I've heard many heartbreaking stories from workers about the trauma that they endured during the pandemic to this day. They were on the front lines while we stayed home. They were neglected PPE and safe working conditions. They continue to show up each and every day to a workplace they could have left to make more money at. I encourage you to listen closely to their stories. Listen closely and think of your loved ones in their hands. Listen closely as they are the backbone of keeping our communities safe. Thank you for your time, and I urge the city to move forward with no amendments to our ordinance language. Thank you.
That concludes our group speakers. I'll go ahead and start the individual speakers.
Thank you, Madam Clerk.
I'll call 3 names at a time. If you'd like to please queue up on the front row, that'd be great to help us with time. Our first speaker is Alan C., followed by Jim O'Callahan, followed by Shay Benton.
Yeah, I'll wait for the slide if you don't mind holding that time. It's going to be the one that shows. Do you mind pausing the time back to 5? Thank you. Okay, yeah, I'll start. Yeah, Alan C. here. Yeah, I'm looking at this. This is already in the works for the entire state. If you're proposing what you're doing here in Chula Vista, which is a working class neighborhood, you're actually going to get more money out of our taxpayers from a working class neighborhood versus the entire state, starting at $18 to $23, depending, from reading that, I don't understand it quite well, depending on what they're actually doing. So there again, we're looking at merit, job skill, which should be the most important thing on a worker's salary, not a flat rate $25 for everyone, including groundskeepers. Nothing against groundskeepers, but the nurse in an emergency situation probably should make a little more than that groundskeeper. So I'm looking at, she mentioned the monopoly, 100,000, she repped 100,000 people at $25 minimum wage for everybody of just the union, but of course that's going to apply to everybody. How much is going to affect everybody? How much is going to affect us? Alonzo, we spoke before about my home insurance, it correlates, and one of the insurance agency will no longer cover homes, what more are some of these insurances, various insurance programs say, you know what, that's it, we're done with California, we're out. The same thing happens. Let's take it a little deeper. As I mentioned the merit, if we flat rate everybody at $25, what happens to the incentive of the good worker versus the bad worker? You lose that drive, you lose that go the extra mile. I want the best damn healthcare service, because we're talking about not a mechanic working on your car, but the best healthcare service available. But if you stagnate it by keeping this minimum wage where there is no merit, there are good workers, there are bad workers. But if you take the merit away, you're making them all a bad worker in the ending. So we're looking at possibly insurance leaving. As I mentioned, my home insurance. What if some of these hospitals decide to leave? If you make the cost of living too high, as we've seen in San Francisco, CVS, multiple pharmacies, multiple this, it can happen to hospitals too. Is this what we want? Is this the healthcare we want? Because if you look back, covered California, which helps the poorest people, working class people, just went up 3 months ago. Did anybody look at that? Did you guys look at that? It just happened like 3 months ago. Covered California for the poorest working class people, it went up 3 months ago. If they get this $25 rate increase in a working class Chula Vista, what's going to happen to covered California? We're going to set separate parameters? So consider all that, and I know you're so quick, hot to trot, pushing this on the agenda so fast because it's for the purple shirts. But the purple shirts don't realize their great-grandkids are going to suffer because they're not going to be union members. They're going to be paying high rent, high everything else. Let's talk about high rent, where she said, well, it costs so much to live in California. Do you know why it costs so much to live in California? Because the stupid idiots in Sacramento keeps raising all these regulations, taxes, fees for the damn unions that put money back in your pocket. You want to really help the people? Get off the union cog and start looking at all your constituents. Because the unions, which, yeah, they deserve, I love nurses, but the grouping here is not everybody in Chula Vista. Let's look at the people paying that covered California, which is the poorest of poor, which you claim equity and all that crap, but you're not following through. Let's look at what they're going to be suffering through. And for the purple shirts, yeah, you're good to go now. What about your great-grandkids? When they're not union workers, what is their life going to be like at $20 per gallon of milk? Yes, that will happen. Is this what we want? How many more are going to leave California? Consider long-term what's going to happen. I yield back.
Our next speaker is Jim O'Callahan, followed by Shay Benton, followed by Ricardo Roman.
Good evening. Jim O'Callahan with the South County EDC. While the intent of the ordinance is undoubtedly noble, it is crucial that we carefully consider its potential economic impact on our community and healthcare institutions before moving forward. The healthcare industry is undeniably vital to our city and its residents. As the proposed ordinance makes its way through the process, we urge you to consider the importance of requesting and conducting a comprehensive study. Such a study will provide valuable insights into how the ordinance may impact not only healthcare providers, but also the larger community, including non-clinical workers and healthcare facilities. It is important to note that there is pending state legislation, as has been pointed out, that is working on a graduated system to accomplish the same goal. With an industry already operating on a slim margin, cuts to services or higher costs passed on to consumers would seem a natural outcome. Considering the complexity of these legislative developments, it is prudent to thoughtfully understand the potential impacts the proposed ordinance would have at the local level. As we have looked at the South County EDC, we have many amazing businesses here that have been supported not only by the healthcare industry, but have come because of the providers we have here in the community. And many of the jobs that they provide could also potentially be impacted by rising costs to their businesses. So we encourage you to take a look at not only the impacts to the industry as proposed, but also the surrounding industries that have come here and set up shop in Chula Vista. So thank you.
Our next speaker is Shea Benton, followed by Ricardo Roman, followed by Pauline Lucatero.
Thank you, Honorable Mayor, Deputy Mayor, and council members. You've opened up your offices for us for meetings over the past month with open ears, which we greatly appreciate. My name is Shea Benton. I'm the Director of Government and Community Affairs at Family Health Centers of San Diego. Family Health Centers of San Diego is a full-service nonprofit healthcare organization that serves as one of San Diego County's largest safety net providers. San Diego County is one of the few counties in California without a county public hospital. This underscores the critical role Family Health Centers of San Diego plays in providing comprehensive healthcare services to this and every community throughout the county. Each year, we serve approximately 225,000 patients, conducting over 1 million patient visits annually. Among these, 27,000 of our patients are unhoused, approximately 25% are uninsured, and a staggering 93% live under the poverty line. These numbers are a testament to the fact that we cater to some of the most vulnerable and marginalized individuals in our community. While this increase is well-intentioned, it has the potential to cause significant harm to our clinics and our services, as well as to other safety net providers in the county. A rapid and substantial increase in labor costs could result in potential service reductions in Chula Vista, specifically in mental health and substance use disorder services, making it challenging to continue serving those who rely on us most. I must also emphasize that we already pay well above the minimum wage for all positions within our organization, with annual increases to ensure competitive compensation to our dedicated staff. However, it's important to note that increases in Medi-Cal and Medicare do not apply to community health centers and clinics like Family Health Centers of San Diego. In Chula Vista, we operate 3 locations that provide critical mental health and substance use services. If the proposed ordinance or ballot measure were to pass, services at those locations could be impacted dramatically. As a recovered alcoholic and current mental health consumer, I know firsthand what that reduction in services could look like to people like myself and folks that I know in recovery. I urge the Chula Vista City Council to consider the far-reaching consequences of implementing a rapid minimum wage increase. While we are committed to providing fair compensation to our employees, such a drastic change overnight would threaten our ability to continue serving the most vulnerable members of your community. I implore you to work collaboratively with organizations like ours to find a balanced solution that supports both our dedicated workforce and the individuals and families who rely on our services for their healthcare needs. Thank you so much for your time and your consideration.
Our next speaker is Ricardo Roman, followed by Pauline Lucatero, followed by Fran Butler-Cohen.
Hi, good evening, Mayor and council members. I am Ricardo Roman, a Chief Financial Officer for Family Health Centers of San Diego. I have watched with interest Chula Vista's Council's evolving minimum wage ordinance and would like to express my opinion as a CFO and one who has decades of financial experience in healthcare. The absence of a financial impact study or economic analysis on this ordinance appears to be a serious omission. The city of Chula Vista has an annual operating budget of over $500 million. Decisions must be made on data, not emotions. When one is a steward for so much taxpayer money, rushing a draft ordinance in less than a month without input from all stakeholders risks making costly mistakes. Merely copying ordinance that were designed for Los Angeles may not work in Chula Vista. Information was circulated on the financial health of our organization. I have reviewed this information and can say the information is inaccurate and was misconstrued over several years. Without going through the inaccuracies line by line, let's just say it was not prepared by a professional schooled in finance or accounting. This ordinance will have significant costs to Chula Vista. It is unfortunate that allowances were not made by City Council to understand the financial impact to the city, nor the impact to the city staff who will be charged with compliance. Determination on minimum wage are best left to the state. This is their responsibility and have the necessary infrastructure to design and implement. Thank you for your time and consideration.
Our next speaker is Pauline Lucatero, followed by Fran Butler Cohen, followed by John Acosta.
Good evening, council members and mayor. My name is Pauline Lucatero. I am a master's prepared nurse, graduated from Point Loma Nazarene University here in San Diego. I'm also proof of Family Health Centers of San Diego's elevating their staff. I joined the organization over 5 years ago as a unit nurse in one of our clinics. Then I became the director of nursing through hard work and my commitment to the organization's mission of serving the underserved. I am also the chief academic administrator of our Laura Rodriguez Medical Assistant Training Institute. This year alone, we have trained almost 25 people by our institute, and another class begins in January. Last week, I submitted yet another state application for approval to offer a licensed vocational nurse training program. Now, both of these programs, medical assistant and the licensed vocational nursing program, are tuition-free. And both offer significant economic value to the graduates. If elected officials decide to raise wages to unsupportable levels, programs and services will be hurt. I am concerned that the organization will no longer be able to sustain my training programs under the mandatory wage increase. What a loss of a training resource for the entire community. And what a loss to those wanting to enter the wonderful field of nursing, as we know we are facing a national shortage. Thank you for your time.
Our next speaker is Fran Butler Cohen, followed by John Acosta, followed by Marcy Weaver.
Good evening, Honorable Mayor, members of the City Council. I'm Fran Butler Cohen with Family Health Centers of San Diego. It's an honor to be here tonight. While the minimum wage ordinance that's being discussed this evening may turn into a moot point given the deliberations on the state level, I think it is important that we at least address the impact of this to our organization. The minimum wage ordinance under consideration by Chula Vista City Council may have gained more support if the following would have occurred. And as I sat there and listened to the dog club, dog lover myself, mother to Annie and Maggie, and formerly Harley, I couldn't help but be struck by the fact of the words collaboration, cooperation, and inviting the dog club people to meet with the city staff to carve out a solution. We never had that opportunity as healthcare workers and healthcare administrators. We would have loved to come to the table before it was rushed into an ordinance draft and hear what your concerns were and hear about your plans and what you would like to see and have the healthcare workers tell you about our challenges and coming off of 3.5 years of managing locally a worldwide pandemic. I will tell you that 15% of our workforce left in March 2020 at my invitation. If you couldn't stay and you had pre-existing conditions and you needed to step out of care, you had my blessing. 15% overnight, just like that, were lost. We didn't have a problem that's purportedly talked about of filling our vacancies before then. We do now, but the problem is not so much with the clerks and the janitorial and the day porters, who we value, and we need to have them in our organization. But we cannot find physicians. We cannot find registered nurses. We cannot find therapists. And that's significant because over 400 referrals of mental health therapists occur every single week from our own physicians to our mental health department. And countless referrals are made to our substance use disorder counselors. They are not impacted by this minimum wage. We would have loved to work with you. And I think that the ills that are created by the pandemic and by the inflation and by everything else that seems to be going on in the world at this point are real. But unfortunately, the minimum wage is not going to purportedly correct all of the issues that face us. We need a strong workforce, but only doctors, therapists, and nurses can treat and lay hands on the patient. The ordinance does not address the critical workforce shortage that exists in the professional staff. According to the Bureau of Labor Statistics, there are 4 million registered nurses in this country that are not disabled and have not aged out of the industry. Why are only 3 million working? Our residency programs have been capped for years. So we were able to find a little-known federal program called a teaching health center and start our own family medicine residency teaching program. Last year, of the 6 that graduated from our residency program, 6 of these stayed with our organization. One of those is working in our Chula Vista clinic. Another one is working from a prior graduate in the Chula Vista clinic. These are the critically needed professionals in our community right now. When a hospital CEO tells me that he cannot find anesthesiologists, we have a community problem. Where the data suggests that, I'd like to know where the data was in the ordinance that suggests clinics were not able to provide care during the pandemic. Our organization remained open for care 6 days a week and vaccinations and testing 7 days a week. Managers, those CEOs, those senior managers that are denigrated, 7 days a week for 3 years, working the vaccination lines, making sure people got care. Our organization vaccinated 250,000 people from San Diego County. With vaccination clinics stood up next to our Chula Vista clinic, and they just went like this all day long. We ran infusion clinics, saving lives and keeping people out of the hospital, and we provided testing services on demand, tens of thousands of those. A $2 increase in a person's hourly wage is not going to allow them to live near where they work, nor buy a house, nor afford the rising costs, the stratospheric rise in rental rates, and we get that. But let's come together and talk about affordable housing.
Fran, your time has expired. Can you please summarize?
Mayor McCann, thank you so much. I think that's basically all that I would like to say, except I would invite again for the City Council to come together with the healthcare workers in your city and have a planful meeting and one that can reap productive benefits on how we can cooperate with issues such as affordable housing, homelessness, and the continuation of quality care. Thank you so much for your time.
Our next speaker is John Acosta, followed by Marcy Weaver, followed by Dr. Chris Gordon. Looks like John Acosta is not in. Marcy Weaver, followed by Dr. Chris Gordon, followed by Donna Baker.
Good evening, Honorable Mayor, Deputy Mayor, City Council members, City Manager, and City staff. I'm Marcy Weaver, the CEO of the Chula Vista Chamber of Commerce. I want to express my sincere appreciation for the opportunity to speak before you this evening regarding a critical proposed ordinance that has the potential to impact not only the healthcare providers, but our entire community. The Chula Vista Chamber of Commerce had the opportunity to speak with stakeholders, large and small business operators, and chamber members. We were extremely concerned by some of the possible impacts and consequences associated with the mandated $25 per hour minimum wage. The unintended consequences discussed included the need to reduce non-reimbursable services to uninsured and indigent, the need to reduce certain categories of services that are now operating at break-even point or a loss, such as women's health care, Planned Parenthood, prenatal care, and mental health services. Wage competition between healthcare providers and non-healthcare providers for certain categories of support services, such as restaurant, cafeteria workers, unlicensed caretaking staff, janitorial and landscaping services. The reduction of Chula Vista healthcare facilities, third-party clinics, and outpatient clinic staff, and mandatory performing operation entities. An immediate minimum wage increase will have a direct and severe impact on health services in Chula Vista and a related impact on our community and local economy. As a chamber, after a review of the factors facing our city's healthcare providers, we cannot support the ordinance under this consideration, which will increase the healthcare sector minimum wage. If necessary, with council's concurrence, the Chula Vista Chamber of Commerce stands ready to help gather funds for an independent study of the impacts this action would have on the welfare of our citizens, one of our major industry sectors, and the many small and medium businesses sustaining our city's economy. We ask that you ensure a full understanding of these impacts and direct city staff to complete an economic analysis for the city council's review before an action is taken. Thank you for your time and consideration.
Our next speaker is Donna Baker, followed by Michelle Guzman, followed by Jeffrey Espinoza.
Good evening, Honorable Mayor, City Council people. Thank you for the opportunity. My name is Donna Baker. I'm the Senior Vice President of Family Health Centers of San Diego. And you've heard from our people that Family Health Centers has a commitment to providing quality health care for underserved communities. One of my roles at the organization is overseeing human resources. So I come to you again, joining many others that have asked for a true economic impact study. And to give you just one sliver of what that is the compression issues. When you raise a minimum wage to $25 per hour, you have significant compression issues all through the organization. Somebody coming in at an entry level, somebody coming in with more years of experience who has been with the company number of years, they're not going to stand still with a minimum wage of $25 and receiving something of that same. What they want is a difference between entry level and what they want to reflect years of experience and years of tenure with the company. So by raising a minimum wage, we're not simply just looking at the impact of that minimum wage, we're looking at the compression issues through the entire organization. That's just one of the many, many, many impacts that raising a minimum wage has. And if those compression issues aren't addressed adequately, what happens then is that's where you have your retention issues. That's where you have the failure to recruit, because people don't see that change, don't see that change through the entire organization. They want credit for tenure, they want credit for merit. And merit isn't reflected in this type of increase, arbitrary increase. We encourage you, when I look at our workforce for human resources, I talk to many people who want a better life for their family. They want a better life for the larger family. They want their children to grow up with benefits. They want a home. The way they're going to get that is not through a $25 minimum wage increase. The way they're going to get that is through their education and through affordable housing. Family Health Centers for decades has been committed to that. You heard about our MA school, you heard about the launch of an LVN school. Here in Chula Vista, you see a partnership for low-income housing. That's how we work toward making our employees have a better way of life. We give them fair, competitive wages. We study market studies. We give them a fair, competitive wage. We also give them scholarships, opportunities in school, and opportunities and avenues through low-income housing. I ask you to take a step back, and I join with the others that have asked for an overall rigorous, independent economic impact study. Thank you for your time.
Our next speaker is Michelle Guzman, followed by Jeffrey Espinosa, followed by Kelvin Barrios.
Good evening, council members and Mayor McCain. I'm Michelle Guzman, and I work in the healthcare field. But previously, I worked in education for both public and private schools. I can assure you that many wages paid in the educational system are not at $25 an hour. The ordinance under consideration by the City Council is not equitable. In fact, many positions in Chula Vista with the city and in the private industries do not have a starting salary at $25 an hour. People in positions that are first responders and who work with children do not have a minimum wage of $25 an hour. So I ask you this: why not make minimum wage for all people in Chula Vista at $25 an hour? Policies should be enacted that are fair for all. And one industry should not unfairly burden, particularly that industry that cares for everyone in need. Thank you.
Our next speaker is Jeffrey Espinosa, followed by Kelvin Barrios, followed by Johan Espinosa.
Good evening, City Council members and Mayor McCann. I stand before you as a representative of Family Health Centers of San Diego, an organization that is a cornerstone that provides crucial healthcare service to our underserved and uninsured community. Our mission goes well beyond just primary care and mental health services. We bridge gaps, ensuring that patients, many of whom are your constituents, don't suffer extended delays in their health care due to staff shortages and lack of capacity. We are opposed to the proposed healthcare worker minimum wage ordinance. It's important to clarify that our stance today isn't against fair competition. Rather, it's an appeal to recognize the unintended repercussions of the proposed wage hike. The proposed increase, coupled with cascading wage increments, would compel us to make tough choices concerning the services that we provide. It's noteworthy to mention that we have always prioritized our staff's welfare. Every single employee is compensated above the state's minimum wage, which is a testament to our unwavering commitment to them. In addition, out-of-cycle wage increases to maintain competitiveness is also embedded in our compensation plans. This ordinance, while well-intentioned, endangers our capability to sustain these indispensable services and could inadvertently result in organizational shifts and potential unintended consequences, such as loss of services. We respectfully urge the board to reflect on the extensive ramifications of this ordinance and what it might have on already strained healthcare services. We stand ready to participate in productive discussions to seek a balanced resolution that champions both equitable wages and the continuity of vital healthcare services. Thank you all for your time.
Our next speaker is Kelvin Barrios, followed by Johan Espinosa, followed by Gabriela Malagon Maldonado.
Good evening, council members and Mayor McCann. It's been a long night. I think we still got probably, 2-3 more hours to go? 5 more hours? Wow. Well, I'll make my comments short. My name is Kelvin Barrios. I'm here representing the Laborers Union, Local 89. I'm here to speak in support of this ordinance. This ordinance actually is somewhat similar to what we've been working with around traffic control and creating pay equity and lifting the floor from, workers that have, the market economics really don't allow for those workers to be lifted up. We've seen it time and again in different industries, and honestly, we believe that there probably should be a minimum wage all around for $25. That would be something great. But that's not what we're discussing here today. We're discussing the workers that work in hospitals, those that are on the front lines, those that take care of us when we need help. It makes sense that if we're going to start somewhere, let's start there, addressing, the pay equity issues, or also the burden on local governments or county governments on folks making substandard wages and then relying on those services. We have heard from Layla from SEIU UHW on some of the data that shows that the hospitals are able to afford this. But of course, if you're gonna ask a hospital CEO that makes millions, it's like, do you wanna pay your workers more and potentially not get a big raise next year? Like, they're gonna say no. Like, no, we don't have the money. No, we can't do it. Oh no, now we're gonna have to move money out of investments to cover it. The money is there. They're able to cover it. I think it's been proven and it's been studied before. There's been a lot of talk about studies and looking at this, and I think council members are all too familiar with studies. Is another word of just saying, let's kill it, forget about it, let's not look at it. Studies are not going to produce any new information than what you already have. I know the entire council has been meeting with folks. You've had meetings with the hospital, different hospital groups, the different union folks. We've met with y'all and again expressed our support for this. And I think with the information that you have now, the information that you're gathering from this public hearing, our recommendation is that you place this on the agenda for next week on its first reading as it's being presented on the agenda. There's been talk about things that are going on at the state level, but that still hasn't come to pass. The state assembly still hasn't voted on a bill, so let's see if that gets out of the state and gets an assurance from the governor on being signed. And if that's the case, taking a look at how that affects local jurisdictions, but that will probably be figured out before next week. So I think there's no need to delay. A lot of work has gone into this. A lot of outreach has gone into it. The information is there. This is very much doable. It's a good way of ensuring that you're protecting the classification of workers. And again, kind of just pushing back on the arguments that hospitals can't afford it. If you're gonna ask management, can you afford to give your workers a pay raise? They're gonna say no every time. Our union deals with different types of bargaining with folks and employers and contractor associations, and again, they always will want to push back when it comes down to the economics. So you gotta take that with a little bit of grain of salt, and looking at the public data that has been presented by SEIU, it does show that the money is there. I also hear that there's more improvements going on at the state level on reimbursements that should help, but when we're having when the hospitals are having a crisis of hiring people and maintaining people, and they wonder, it's well, maybe, if we pay them better, we'll have better retention rate. If during COVID we had such a big issue like that, it's a natural thing. You pay someone, they're gonna wanna stay. Someone made a comment that was a little bothersome that, oh, if you pay someone $25, now there's no incentive for them to do a better job. $25 gives you an ability where actually hospitals will have a better caliber worker, I believe. It would be more competitive to recruit, to retain. You're getting paid better, and if Chula Vista becomes a city that's paying better than other regions, then the hospitals here are gonna have the best workers. So that is something to keep in mind. Again, Kelvin Barrios with the Laborers, here representing Valmacedo and our 4,000 members, and we stand in support with SEIU UHW. Thank you.
Our next speaker is Johan Espinosa, followed by Dr. Gail Howard, followed by Tom Gamery.
Good evening, council members and mayor. My name is Johan Espinosa, member of community here in Chula Vista. I'm here to speak in support of placing the full ordinance on the agenda next Tuesday, September 19th. Currently, some Chula Vista healthcare workers are making an average of $22 an hour. Others are making between $15 and $17 an hour. The wage is not high enough to live here in Chula Vista. I believe Chula Vistans, especially essential workers, should be able to make enough money not to just live a happy, healthy, not just to survive, but live a life with the flexibility for them to live happy and a healthy life. Healthcare workers in our city should be able to perform their job without worrying whether or not they're going to be able to pay any bills this month. In turn, Chula Vistans will benefit from healthcare workers who are happy and will stay in their fields in the long term and saving their employers money in the long run. With rising costs of living in our region, healthcare workers are also impacted because they may be struggling if they have a family to care for or may delay starting a family as a result of lower wages. Furthermore, we all remember showing our gratitude to healthcare workers by calling them our heroes because they were in the front lines fighting for our lives while risking theirs during one of the worst pandemics of our lifetimes so far. I'm sure being called a hero must have felt nice. I'm more confident that they would feel more appreciated if they were given the opportunity to not just survive, but to thrive with a fair wage that allows them to take care of themselves and their families. Council members, mayors, for as long as I've lived here in Chula Vista, one thing is clear: Chula Vistans take care of each other. They are wary of outsiders and are proud of every Chula Vistan doing great things around the world. And I'm sure you want the best for all Chula Vistans. Please vote in the affirmative and place the full ordinance on next week's agenda. Thank you so much.
Our next speaker is Dr. Gail Howard, followed by Tom Gamery, followed by Clara Evans.
Good evening, everyone. Mayor McCann and council members, thank you for taking the time to listen to this. It's been a long night. I can't resist making a comment about data because prior to my position as an ophthalmologist with a practice here in Chula Vista, I did a PhD. I had to learn a lot about data. And I would just say, anyone who doesn't want to look at the actual data for what's important to Chula Vista, there's a reason they don't want you to look at that. When people present data on a statewide level that doesn't necessarily apply to the area, it's because they don't want you to look at the actual data that's in the area. My practice I've been a part of here in Chula Vista for 16 years, but the practice has been here over 60 years. And I am privileged to be a part of it and get to take care of patients here in Chula Vista. Most of my patients as an ophthalmologist are over 65. Most of them are Medicare patients. Most of them have adult children who help get them to appointments. I don't want to see a change in the ability of Chula Vista to take care of these patients. I don't want to see primary care doctors pull out because they can't afford to be in practice. I don't want to see healthcare workers not make a livable wage. I just want to see it done in a way that is actually going to be feasible and is going to keep the care here in our community for our patients. I don't want my patients to have to go somewhere else. I don't want them to have surgery somewhere else. I want them to be here in Chula Vista. I want my staff to be happy. I want them to have a good life. I want them to get the minimum wage. And I think our grounds people should get the minimum wage. I just want to see it done in a way that is supported, that businesses can stay in place. I'm not sure what an economic impact study really needs to happen, but I know if that's what would help keep businesses in practice, if that's what would help keep lines of service here in Chula Vista, then I think it is worth the time. I know that what's happening at a statewide level is likely going to make some of this moot. I know that there are some amendments that have been proposed that will likely pass this week that will actually enact these things in the next year and phased in over the next 1 or 2 years. So I'm a bit disappointed at the way some of this is being presented here. I hope that you will listen to what your community needs And I hope you will listen to what your patients need in this area, and your business owners, and your primary care providers. I hope that you will take all of that information and make a good decision in a way that will keep your care here in Chula Vista. Thank you.
Our next speaker is Tom Gamery, followed by Clara Evans, followed by Lindsay Wade.
It was a good attempt at my last name, by the way. It's Gamir, but you did well. I appreciate that. Good evening, Honorable Mayor and Honorable Deputy Mayor and all of the City Council members. I am Tom Gamir, and I am the Regional Chief Executive at Scripps Health. And I'm 37 years at Scripps and have been involved in Chula Vista healthcare the entire time. Scripps, you know, as we have this conversation tonight, we appreciate the opportunity to come and talk about this really important topic of our people and their ability to make a living and the impact that they've made. And we know that these conversations are going on in city governments throughout the state. And we've heard tonight about the state proposal that is on the table. One of the things about that state proposal that to us makes more sense is the idea of some kind of phasing in plan. Makes it more achievable, makes it more reasonable, an approach that allows for the ability to have a plan and address it. We're still not sure how it will be funded or how it will be paid for. There is no real plan for that. And I think it's important to just comment about that. When Scripps looked at this state plan, we knew the impact would be dramatic to us. And of course, we want to pay our people more. But our study showed it would take about a 30% increase in the payments that we would receive from health plans in order to fund it and sustain it over a period of time. We can't go ask health plans for 30% increases. That's not going to happen. The other part of it that is important to understand is
Tom, can I just ask you a quick question?
Yeah.
When was the last time Medi-Cal reimbursement increased in California?
Well, you're reading my mind. I was just going to mention that. So one of the other parts of this is that reimbursement from the state, Medi-Cal, to hospitals, there hasn't been an increase in over a decade. And that's what's causing a lot of the financial stress and pressures. You earlier from my colleagues at Sharp about the fact, and Scripps is no different. 4 out of 5 patients are government payers. 40% of all the patients seen at our Scripps Chula Vista site are Medi-Cal. And we haven't had an increase in over a decade. If we were able to get some funding levels, it makes this type of proposal much more reasonable and sustainable going forward. Healthcare is not like other industries. Costs have risen everywhere and in other businesses. And of course, they've had to raise their prices and what they charge their customers. Healthcare doesn't work that way. Most of our reimbursement that we get from the government, they just basically, that's decided, and we have to accept those payments unilaterally we can't go and increase our costs or our charges and pass them on. You've heard the word distressed hospital. I wanted to share that. There was an earlier comment about there's a fund that has been created because some hospitals have closed in the state, and there have been identified that those hospitals that are in distress can apply for a fund. That doesn't apply to hospitals that are in systems, in large healthcare systems. So even though our hospital, in the Scripps Hospital, the Sharp Hospital, may qualify if they were a standalone hospital system or a hospital, we are not eligible to apply for those additional funds. Our Chula Vista Hospital is an example. In the period from 2000 to 2022, lost from operations nearly $50 million. The cost of this proposal would add another $10 million in annual costs to the hospital operations. This year, we're projected to lose close to $35 million from our operations from our Chula Vista site. These are real concerns. I would add, as has been already stated, that it would be really important to get an objective review of the impact this will have on the community, and not just to hospitals, but to our community clinic partners, to physicians, and to other parts of our healthcare system. And I think a red flag that we have to pay attention to is, for example, the recent closure of a skilled Frederica Manor, one of our community centers.
Can you please summarize, please?
I'll summarize. Thank you, Mayor. I appreciate you giving us the opportunity, and I would highly recommend that the council consider studying this a little further before moving forward.
Thank you.
Thank you.
Our next speaker is Clara Evans, followed by Lindsay Wade, followed by Demetrios Alexou.
Good evening, Mayor and honorable City Council members. My name is Clara Evans. I am the Vice President of Government Affairs at Rady Children's Hospital. While Rady Children's isn't physically in the city of Chula Vista, we do provide primary and specialty care services to the community. We also have a special partnership with Scripps Chula Vista by providing services to the babies in the NICU. Thank you for the opportunity to address this draft healthcare ordinance. I stand here in support of you pursuing an economic impact report to get a full, thoughtful review of what this ordinance might do. You heard earlier tonight, this is also a conversation that's happening at the state level. So I want to echo many of the same comments that my hospital and other healthcare colleagues have shared with you tonight. The healthcare industry needs consistency and predictability and security so that we can continue making the necessary fiscal decisions to maintain access to care and frankly, to maintain jobs in our communities. Rady Children's firmly supports paying our healthcare employees a fair living wage. In fact, in recognition of their heroic efforts during the pandemic, as well as the growing costs of living in the community of San Diego, in December of 2020, we increased our wages to $20 an hour for all our staff across the organization. We were able to do this through a thoughtful process, balancing our fiscal viability and the needs of our employees, and it certainly did not happen overnight. That is why we strongly urge you to seek an independent economic impact report that would provide the necessary insights to make sure that we can make the best decisions for our community. I want to underline one important point that Mr. Gamir and others have made. Healthcare is not like other industries. In healthcare, we are interconnected. This unique interconnectedness is what we are able to do to maintain access to care, including in underserved communities. Tipping the delicate balance of the safety net without a thoughtful approach will have a negative impact on our communities. Thank you so much.
Our next speaker is Lindsay Wade, followed by Demetrios Alexou, followed by Lorenzo Rodriguez.
Good evening, Mayor, Deputy Mayor, and council members. My name is Lindsay Wade, and I'm a Senior Vice President at the Hospital Association of San Diego and Imperial Counties. We represent more than 35 hospitals and health systems in the two-county region, and I want to thank you for the opportunity to comment tonight. It's very late, and I know that we all need to move on with our lives, but I want to just emphasize the importance of everything that we've already heard tonight from the healthcare community. During the pandemic, you saw community clinics and hospitals and the whole community come together in a really meaningful way and take action and be flexible and be responsive to community needs. And that's how we are. We have a fragile healthcare ecosystem, And we all work together to preserve access in our communities to make sure that services are available where people need them. And taking a drastic action, like an ordinance that increases the minimum wage within 30 days or in January, depending on which part of the ordinance you read, really would have unintended consequences across the entire healthcare region. So I want to ask just a few things this evening. Please continue to work with us. We're here. We want to share information. We have the opportunity to learn and understand from the legislation that the state is considering right now, and are happy to continue having conversations and sharing any other data and information that you would like. I think we've been as transparent as possible, and we'll continue to do that. And then also, it really is important, as you've heard over and over again tonight, that if you do decide to move forward with something based locally here in Chula Vista, it's absolutely essential that you take the time to do an economic impact analysis and not only understand the economic impact, but also the potential impact to access to health care for residents in Chula Vista. Thanks, and have a good evening.
Our next speaker, Demetrios Alexiou, followed by Lorenzo Rodriguez, followed by Steve Sandoval.
Good evening, Honorable Mayor, Deputy Mayor, City Council, and City staff. Definitely has been a long evening, but a lot of thoughtful and good discussion. And really appreciate the opportunity to be here tonight and speak with you. I would just say first and foremost, obviously healthcare is something that is personal in our communities. It's something that everyone values until you don't have it. And in terms of just the ordinance itself, what I would share is a few thoughts. You know, as we talk about our opposition and concerns with the ordinance as drafted, one, let me be clear. I've yet to hear one healthcare or hospital speaker say no and heck no to anything we're talking about. So let me just refute what was said previously. None of this is about burying it. It's about being thoughtful with our conversations. And in terms of being thoughtful, you know, some of the things I would share is, you know, in terms of what is in the draft ordinance, there's no runway to implementation. I don't know about you. I'm not sure how the city operates. I have a great idea, but I can guarantee your budgets aren't made 30 days out. Those are things that take time, take lots of planning and lots of information. Additionally, the lack of ability to make operational changes. I've also not heard anybody come up here from our healthcare organizations who say they don't extremely value all of their employees, but the ability to make operational changes to right size, to be able to deal with, you know, significant cost increases is imperative. And without doing so, the only other option you have, contrary to what others may say, is to look at programs and services. And so that's the thing that nobody really wants to do. Nobody wants to reduce services. Nobody wants to make any changes that would impact the community. Even has been previously said, think about the pandemic. The fact of the matter is our hospitals, our clinics, and other providers came together to do what was right for the community. It's not that there was funding to take care of all those increased costs and expenses. It was the right thing to do, and everybody stepped up to the plate and did that. In terms of the impact to hospitals, 51% of hospitals are operating in the red statewide, according to a Kaufman Hall study. You've also heard a distressed hospital program that the state created. If hospitals were financially flush, why would we need to create a distressed hospital program to stand up hospitals that were struggling? Hospitals already do pay significantly higher than the minimum wage and want to continue to be employers of choice and do more. Again, I've yet to hear one healthcare speaker come up here and say, we don't want to pay our employees of what they deserve. But it's got to be thoughtful and well thought out. In terms of the draft ordinance, what I can share, obviously there's other providers or clinics, dialysis, physicians, you've heard from a lot of folks tonight, but what I can share is the draft ordinance itself would add over 20 million in added and unplanned expenses annually. That is not an insignificant amount, and that's just here in Chula Vista. And as one speaker previously mentioned, that doesn't even deal with the compression factor. Once you start to deal with compression, those costs go significantly higher. Tom Gamir also mentioned, you know, some things that were on my plate, but I want to reiterate, there have been no increases to Medi-Cal in over 10 years. As it relates to Medicare, which is another large payer, as we talk about government payers, it's primarily Medi-Cal and Medicare, there have been minor increases. CMS, for example, this year gave a 2.8% market basket increase in terms of Medicare rates. And that's at a time when average expenses and inflationary pressures exceeded 10%. We've got a simple math problem here. You can't have no increases on Medi-Cal, 2.8% on Medicare, 10% just alone in expenses, and think that somehow financially things pencil out. They don't. And as I mentioned, Medicare and Medi-Cal, just so we're clear, that makes up typically over 70% of a market share of any of our hospitals and health systems within the region. The other point that's also been made is the impact to this is beyond just healthcare. Increasing minimum wage is one thing, but to think that it's just going to happen in a silo to healthcare, there are no new employees that are created here. So what we're going to be doing is competing with our hotels, which obviously there's a new convention center, more hotels down here, competing for employees. And that's not something that benefits the region. It benefits to have more employees, and that's where the pipeline programs that you've also heard are the things that are important, especially as we're talking about financial stability in the future. Those are the things that create careers, not just a minimum wage. Therefore, what I would just reiterate is that we do need further time to study. That doesn't mean bury, that just means actually understand what we're trying to accomplish here and what those impacts would be, not just to our hospitals, not just to our clinics, the community, but also to the city. Because that's one thing we haven't talked about, is an ordinance like this will bring cost to the city as well. And therefore, as we do that, it's important that we do get a third-party analysis of that, and as we continue to watch what's happening at the state level, which frankly may render a lot of this conversation a moot point. But thank you very much for your time this evening. Obviously, don't envy the difficult position in your deliberations. Thank you.
Sir, I didn't understand who you were representing. I got your
Sorry.
name. You did a really good job with your name, but no.
Demetrius Alexia with the Hospital Association of San Diego and Imperial Counties.
Thank you so much.
You're welcome.
Our next speaker is Lorenzo Rodriguez, followed by Steve Sandoval, followed by Lorena Mendoza.
Thank you very much. Good evening to every one of you. Thank you for taking the time. I love Chula Vista. It's a beautiful city. I'm Lorenzo Rodriguez. I'm a CNA. I've been in the healthcare field for 38 years. Plus, I'm also vice president of SAG-AFTRA in San Diego, but I'm not here for that reason. Healthcare workers were on the front lines for the COVID-19 pandemic, risking their lives, helping other families. I don't have any good statistics or anything like that, but as a healthcare worker, it is tough out there. It is so tough out there, working every day, trying to make some money, and you have to love this job. When I was going out of the elevator one day, one family member says, "How do you guys do this? How do you guys do this?" Someone has to do it, But this ordinance needs to pass. If not, the state will pass it. But it's just a little money. How do you put a price on that? You can't. I guess I'm the only health worker that just speak today. Some of them had to go to their other jobs, 2 or 3 jobs. They've been on their feet all day. Do what you need to do. You need people to help you, to take care of you. When you have your health, you have everything. And when you don't, and that's all I have to say. Thank you. God bless you.
Our next speaker is Steve Sandoval, followed by Lorena Mendoza, followed by Victoria Barron.
Ready? Thanks for having me here today. My name is Steve Sandoval. I work for Sharp Grossmont Emergency Room. Been with them for about 12 years. I just want to say it's a hard job, what I do every day. I walk about 10 miles a day at work to make sure I get to everybody. It's we deal with a lot of patients. It's a really hard job. I work 2 jobs. I work 40 hours a week.
Mr. Sandoval,
you need to... I work another 25 hours doing a second job just to be able to make ends meet. It's really hard to be able to live here in Chula Vista. As a single parent, I've lived in my car to be able to help and take care of myself, to be able to pay first and last month's rent. It's a really hard job to do. I just want you guys to help, support us, and take care of us as we take care of you.
Our next speaker is Lorena Mendoza, followed by Victoria Barron, followed by Kelly Solarak.
Hello, everybody. My name is Lorena Mendoza. I'm a home health aide at Char Hospice. So I'm here so proud to be one of them that wear the purple color. I'm gonna tell you about my day by day, what I see. We have to deal for a lot of things during the pandemic. Let's start with that. But we don't feel that our management, they don't support us a lot. So we have a lot of problems during the pandemic. We ask for a raise, for example, and they say, maybe it's better that you go, that they start to think to go to another city. We don't receive any. When we talk, like, for example, about the rotation payment, we are not like frontline workers. We don't know, we don't receive it. We don't receive any penny because they don't consider us the frontline workers. Sorry, I'm very nervous, but I wanted to tell you everything because I see my friend there crying. There is my coworkers, my sister crying. And I feel so bad that a lot of people is not supporting us. They are not there seeing what I see. For example, I had to work during the pandemic and before, like 2 jobs. 2 jobs, why? Because we don't have enough staff. I don't know if one of you would like to work 2 jobs and receive 1 payment, because I receive it. I asked for an extra payment because I was working for 2 positions. Home health aide, feeding my patients, giving baths, and also working as a homemaker, preparing food, feeding the patients. You can imagine sometimes I have 4 patients in my facility and sometimes 6 patients. But I have to cook and then go to feed a patient, then return, cook again, and go there. And many of us in the hospitals, because when I was in the hospital, sometimes during the night shift, I have 26 patients for me. Can you imagine having your parents, your mom, your dad, when just 1 person to give care? I love my job. I really love my job. I like to spend time with my patients. Sometimes they are alone. They need a minute to talk, and no, I'm just talking with them and checking because my phone is ringing that somebody else needs help. So that's why I support this minimum wage of 25, because a lot of people need it. I really appreciate that you hear me, and thank you so much for your time.
I want to thank all the speakers and everything. We need to take care of our people here, including our translators. So we're going to take a 13-minute break. So we will be back at 10:30. So appreciate everybody, but we are going to take a quick recess. Thank you, Doctor.
Good evening, Honorable Mayor, Honorable Councilman, Council Girl. I have heard very good points of view of both sides, and they are very respectful. I am very impressed. I am here to give you the point of view of the primary care physician. My name is Jose Ramiro Lopez, and I have been more than 35 years primary care physician in Chula Vista. So let me tell you what this ordinance of $25 will make in the primary care physician point of view. First of all, let me tell you that from the primary care physician point of view, $25 is nonsense. Why? Let me give you an example. Community Health Group is an HMO, medical HMO, pay us, the primary care physician, $12 per member per month. If you pass this ordinance of $25 per hour, we have to pay $25 to the front office, $25 to the back office, $25 to the referral lady, and $25 to the care coordinator. $12, even if we see the patient once, we see the patient twice, we see the patient 3 times a month. And you want to give us this ordinance of $25? Sorry, but this is completely nonsense. You are going to press a lot of economical hardship into the primary care physician. We already have a deficit of primary care physician in Chula Vista. If you do that, you're going to put a lot of economical pressure and hardship, and many offices of primary care physician of Chula Vista, we're going to close. And if we close, who is going to see the homeless? Who is going to see the low income of the members of the patients that we have here? Who's going to see them? Who's going to see you if we don't have primary care physician? We are the most important specialists of the healthcare system. We are the basics. We are the one who direct the whole orchestra of the medical care. Who's going to see you if you don't have primary care physician in Chula Vista? Who's going to see your children? Who's going to see all of them? So please, from the primary care point of view, $25 is nonsense when we receive $12 a month per member. Thank you. Thank you for your listening.
Our next speaker is Victoria Barron, followed by Kelly Solarak, followed by Michelle Esparza. Looks like Victoria might have left. How about Kelly Solarak? Michelle Esparza? I'll go on to the next speaker, Eunice Antonio.
Good evening, everyone. Mayor, council members. I'm Eunice Antonio. I work as a patient care technician at Fresenius Medical Care. So basically, the fair wage for the healthcare, like me, I work in the industry for more than a decade now, but nothing I can afford. Things a very basic necessity that ensures my safety and comforts to have my own rented house or apartment that I can call it my home. The first thing that I can make my own decision to what should my family has to have inside the house to protect us and have a safe place to stay. I'm unable to make ends meet to even pay it was renting a room to my family members. No privacy at all. Now with the minimum wage, this will give me an assurance that we're able to pay a decent house for safety, but good, nice foods to, to the table. As a patient care technician, I work for more than 11 years already. So basically, I'm working I couldn't really afford the things that, the basic needs that I need. I'm shaking right now. I've been crying because I'm hearing all the people, from healthcare industry avoiding to pass the 25 minimum wage. But at the moment in time, as a patient care technician, I work with the patients. It's like pretending that like pretending outside, they don't even know what's going on, in the outside world. But inside of the clinic, you have to be happy, make them feel like they're welcome, because they're like the second family, because every day you were there, taking care of them, helping them to prolong their life. They have their own problem with their kidney disease, actually, but, inside, they didn't even know that we're smiling. I even
I even make a joke with the patient to make them happy because I know it's really hard for them to be there, sitting there and get dialyzed, you know, and as a worker, I can't show myself that I'm so weak because they're going to be feeling so, you know, depressed and more depressed that we're not happy about our own lives, but we have to make sure, you know, we finish our job and then make sure they were happy when they come and then when they leave. But after that, they don't know nothing about us, you know, but we have to smile and make them happy because we have to prolong their life. That 25 is actually nothing at all. You know, the job, that the care with the job and our patients' problems is so hard because I see, you know, the struggle of the patient. So basically our patient is the primary cause of this one, you know. We're lack of workers at work, so we're bombarded of so many hours to work, you know. We can't do anything about our own health. So if we can't take care of our own health and we're not making any money, I can't even go to the doctor because I have something like I need to be checked. The copay is $4,000, you know, but I can't feel it anyway, so I just left it behind. But because I'm not really making. All I want is to at least a livable wage that I can say, hey, I can live in my sister's house and make my own, you know, apartment. I can't. It's not enough to what we make, you know. But as far as I know, our company is making billions of money. I don't know whoever made that up, but I don't know we made it up. But it's not, you know, it's not something that, you know, our company, you know, will not gonna say that they're not making money. Even in pandemic time, they make a lot of money. But they call us heroes. Or heroes works here, but we're just laughing about it. What's becoming a hero? They're not giving us anything. Cents, can't even a bubble gum on it. So with that one, you know, please consider thinking about how we feel about that one. I'm sorry, but this is how, you know, this is my story because I struggled so much.
Thank you.
I'm sorry. Thank you so much.
Our next speaker is Joni Vargas, followed by Maria B. Marcado and Myra Rendon, who, for the interpreters, we will need an interpreter for those two speakers.
All right. Good evening, council members and mayor. In August, I stood before you sharing my personal journey as a healthcare worker and the challenges we face daily. I spoke of my hero, my father, and his years of service. Today, I return, not out of choice, but necessity. I've learned that certain healthcare organizations, including Scripps and Sharp, have invested significant resources in urging you to reconsider your stance on a $25 minimum wage. It's commendable how swiftly these organizations can mobilize their vast resources when their interests are at stake. Yet one can't help but wonder what if such vigor and commitment were directed towards uplifting their employees, the very hands that heal, that care, that serve. These organizations, with their polished images of community support and care, seem to prioritize their financial interests over the well-being of their employees. The narrative that a $25 minimum wage would harm their operations is a classic example of the slippery slope logical fallacy. It's a diversion, a smokescreen. Behind it lies the stark reality, the yawning gap between their substantial revenues and the wages of their workers. When these organizations sidestep their responsibilities, it's the taxpayers who bear the burden. Hospitals, especially when they cry financial distress, often turn to taxpayer support. Yet they seem more inclined to perpetuate disparities, not just for their workers, but also for the very taxpayers for whom they seek assistance. It's curious how some organizations can find the means to lobby and influence, yet claim helplessness when it comes to addressing the needs of their workforce. This dance between public relations and actual commitment is almost histrionic in intensity, a performance art that masks the hegemonic interests at play. Healthcare workers are often portrayed as heroes, but are we only heroes in advertisements and press releases? Or do we deserve to live and thrive in the communities we serve? I urge you, council members, to see beyond the crafted narratives and the corporate theater. Remember the faces and the stories of the healthcare workers who serve your community. We are not asking for luxuries. We are asking for a wage that reflects our value and contributions. In making your decisions, I hope you'll consider not just the interests of powerful organizations, but the real-life implications for workers like me and the taxpayers of the community. Let's ensure that the title of Healthcare Hero is more than just a slogan. Yesterday was 9/11, a day that holds personal significance for my family and a day that will forever be etched in the collective memory of our nation. It was a stark reminder that we should never take for granted the safety of our country and our loved ones. Today, let's remember the service of healthcare workers and recognize the wrongs done by healthcare organizations. Let's not take for granted the promises made in plain sight by healthcare organizations, for sometimes they might not be as they seem. It's disheartening to see those in position of power and influence speak out against the very workers they rely on. We, the healthcare workers, are the faces that represent the spaces these healthcare organizations occupy. Yet, some chose to perpetuate this atrocity sitting atop their pedestals, all while projecting images of virtue and victimhood. It's time to recognize and rectify the disparities that keep us struggling. Thank you.
Our next speaker is Maria B. Mercado. How about Myra Rendon? Bridget Browning?
Good evening. My name is Bridget Browning. I'm the Secretary-Treasurer of the Labor Council. I'm also a proud member of District 2. I live close to Councilmember Preciado. I have to say, I haven't been this angry at a council meeting in a really long time. ¡Qué desmadre! We have to sit here for listening to people talk about caca and hilltop when you've got workers that can't survive, while you've got bloated CEOs making hundreds of thousands of dollars that are comfortable in their nice houses. They're not making decisions about whether they're gonna get their insulin or pay their rent. I mean, if you all aren't outraged listening to this, there's something wrong with you, because this is not okay. If they are saying they may pay a living wage, I'm sorry, if they were paying a living wage, this law wouldn't affect them. $25 is not a living wage. You know, I come from the Hotel Workers Union. We're gonna be fighting for $30 an hour in our contract that expires next year. So all the Gaylord workers are gonna come from Sharp and Scripps because they're not gonna wanna work there. I mean, there is no reason that you couldn't take less of a salary so that you could give the poorest of the workers dignity and a life for their families, because we all pay the price for that. Their workers are making so little that they can qualify for Medi-Cal. Who pays for that? All of us. When they have 2 jobs and their mom's not home to help them do their homework, then we're gonna demonize the teachers because the kids aren't doing well in school. We're all paying the consequences of this greedy behavior, and it needs to end, and we're here in full support. Thank you very much.
Our next speaker is Brian Reyes, followed by Christopher Novea, followed by Khalil Jet.
Good evening, council members. My name is Brian Reyes. I am a patient and an ally of healthcare workers, urging you to support passing a $25 minimum wage. I am here on behalf of SEIU UHW. Not only am I a supporter, I used to be a healthcare worker myself. I was a patient transporter who was called a healthcare hero. I was called a healthcare hero for a few years and then called crazy for demanding better pay. I was paid $21 an hour to transport my friends, my fellow coworkers, and hundreds of patients to a morgue during the pandemic. As a 22-year-old, I had firsthand experience with more death than I could have ever imagined. Most people don't experience death until they're in their 40s. Yet I transported more bodies than there are days in a year. We were called heroes for stacking patients on top of each other in a 50-foot long refrigerated trailer. Heroes because we jumped in to perform CPR on COVID patients, no questions asked. But I chose to walk away from the healthcare industry that I called home for 6 years. The pay was not worth the stress and depression it put me through. Like countless of other healthcare workers, I was burnt out. I was no longer a hero when the hospital industry started denying us better pay, saying that they couldn't afford it when we all know that they profited during the pandemic. Without a livable wage, more and more healthcare workers will walk away like I did. I urge you to hear the voices that protect our patients on the front line and support a $25 minimum wage now. We cannot wait any longer to give workers a livable wage. Thank you for your time and consideration.
Our next speaker is Christopher Novea, followed by Khalil Jet, followed by Elizabeth Kusiak.
Good evening, council members and mayor. My name is Chris Novoa, and I am a union representative for SIU UHW, and I am in support of the $25 an hour minimum wage. So I will keep this short, because a lot of healthcare workers, a lot of leaders of our organization have been out here sacrificing their time, explaining to everyone on the council why this is so important, right? And so they've made this sacrifice, and we need to keep that in mind. So a fair wage for healthcare workers would mean that workers wouldn't be forced to leave the jobs they love for less stressful and potential higher paying jobs. One of the speakers that's against the $25 an hour minimum wage talked about 4 million nurses across the country that have their license, but yet only 3 million of them work. I would bet that a big chunk of them are burned out, just like my colleague Brian said, and chose to left the profession because they are not adequately supported. The corporations and the hospitals that they worked with did not give them the resources or the emotional and professional support to stay in the profession, so a lot of them chose to leave. So I know that a fair wage for healthcare workers is essential for the health of our communities, both for our patients and also for the employees here. I would bet that increasing the $25 an hour minimum wage would increase revenue, right, in the city, not only in the spending that healthcare workers would do here, those healthcare workers that live in the city of Chula Vista, but when it comes down to it, those workers that are paid $25 an hour would have enough to be able to go to the grocery store and make sure that they are taking care of their families and not deal with the stress of working 2 jobs and having to pay their rent. And so ultimately down the line, that leads to positive health outcomes, right? Where in the future, a lot of those folks would live healthier lives, and there would be less of a need for those resources, those services that the hospital claims that are so precious and so at risk, right? If you're raising the $25 an hour minimum wage, ultimately those healthcare workers will live healthier lives and they would need less services. And so that's very important to keep in mind. So I urge you to hear the voices that protect our patients on the front lines and support a $25 minimum wage now. We cannot wait any longer to give workers a living wage. So thank you, everyone.
Our next speaker is Khalil Jet, followed by Elizabeth Kusiak, followed by Alex Gordato.
Good evening. My name is Khalil Jet. I am a labor union organizer with SEIU UHW, but I didn't always start that way. My career originally took off in the healthcare industry. I worked in psychiatry, providing counseling and therapy to patients of all ages, starting from 6 years old up until geriatrics. I'm here speaking on behalf of healthcare workers, speaking on behalf of UHW as well. Healthcare workers need a higher minimum wage. And the reason being is, I loved my job. I woke up every day. I felt fulfilled I loved to help some of the most vulnerable people during a very vulnerable time in their lives. There were road bumps, hiccups, in the job, but over time I saw that those road bumps continued to grow larger and larger, and over time they turned into breaking points. One breaking point being a 16-year-old patient who was on the verge of suicide, needing to talk with me, but I didn't have time to give her any counseling, any therapy, and that night ended with her cutting both of her wrists. This is a very serious conversation for a very serious issue. They bring up the pandemic a lot. The average in-house treatment for hospitalized patients for COVID is actually, I think, around 40,000, give or take. And, you heard it from them, they housed and treated a majority of the COVID patients here in Chula Vista, right? So it sounds like profit to me. Not to mention, while they're profiting from the pandemic and while we're suffering, it seems like all these major high-ups in the hospitals figured out we can have all this work done, actually have less people doing it, and actually maximize our profits. With that being said, I loved my job in healthcare. I was pushed out. I was forced out. I went to school, graduated from college in order to do my job. I left because not only was I overworked, not only were we understaffed, not only were the patients not being served properly, but I couldn't continue to carry the burden, not only at work, but carry the financial burden at home as well. It was full circle. And, when thinking about this minimum wage, right? I was fortunate to find another career where I can continue to put my time and my effort and feel fulfilled in supporting patients and lifting the industry, but all these other healthcare workers may not be so lucky. They might leave healthcare and continue on to other fields where they won't be able to continue to provide patient care. And the people that provide this patient care, 1 in a million, honestly. And so with that being said, you cannot afford, your families cannot afford, your grandmothers cannot afford, your children cannot afford to let these people leave. We will all suffer. We will all suffer. I'll say that again. And, it's one thing to be listened to, but it's another thing to be heard. And healthcare workers in Chula Vista will not feel heard unless something is done. Thank you.
Our next speaker is Elizabeth Kusiak, followed by Alex Gordato, followed by Alexis Salazar.
Good evening, very late evening for all of us. My name is Elizabeth Kusiak. I am a certified physician associate, and I have worked in healthcare for 11 years. I really appreciate the opportunity to share this evening. I want to first recognize how late this meeting has extended, and unfortunately, how that has negatively impacted the representation present at this point in support of this ordinance. I am deeply disturbed and thoroughly disgusted by the threats and consequences being suggested by hospital and community clinic executives tonight. If they truly cared about patients and their missions, they would provide for their own staff in a way that is consistent with these values. Over my 11 years in healthcare, I have seen my colleagues leave the industry en masse. Certified nurse assistants, medical assistants, technicians, nurses, licensed professionals. The scope of this exodus affects all corners of healthcare. Our jobs are physically demanding, emotionally laborious. Oftentimes, we are asked to care for more patients than one person can as a result of these staffing shortages. Healthcare is in crisis. Without immediate action, we will not have enough workers to sustain the needs of our community. A lot of executives and managers who have spoken tonight are misconstruing financials, intentionally confusing to instill fear, uncertainty, and doubt. I can break this down a bit. Nonprofit status is a status reflecting how an organization pays taxes, or rather, how they avoid paying them.
Yep.
Money for $25 minimum wage is available. Nonprofit organizations have public tax records. A simple Google search provides full tax filing for healthcare systems like giants like Sharp and Scripps. According to their tax filings, Sharp's assets increased by $70 million in 2022. Scripps increased by $250 million. I implore you, please do not let the influence of wealthy health systems affect your consideration of this necessary measure. So few of the speakers tonight are actual healthcare workers. Do you know where they are right now? Starting their night shift or getting what rest they can before their shift tomorrow. I am a frontline healthcare worker, and I know the impact this measure would have for my colleagues. As a licensed advanced practice provider, I rely and count on support from medical assistants and patient access specialists. I could not provide care without them. Turnover in these roles in my workplace is 25% annually. People are incentivized to leave healthcare, to work less strenuous jobs for better wages. Healthcare workers are not a bottomless supply. This work requires knowledge, experience, and compassion. It is essential to retain workers in this industry, to support patients' access to care, and maintain the quality of care our community deserves. $25 an hour is not a significant ask. This is the minimum needed to support the cost of living in Chula Vista, one of the most expensive cities in the world. Every role in healthcare is crucial. No one is expendable. It is time we start treating our healthcare heroes as such. Please secure a $25 minimum wage for healthcare workers in Chula Vista. Thank you.
Our next speaker is Alex Scordato, followed by Alexis Salazar, followed by Erica Rodriguez.
Good evening. My name is Alex Scordato. I am a clinical training specialist. I work at Planned Parenthood of the Pacific Southwest. I don't know if you can tell by what I'm wearing what my position is, but today is actually a very special day. Planned Parenthood of the Pacific Southwest has actually voted to unionize. We had This has been over a year in the making. Hundreds of workers showed up and voted yes to improve their workplace. I understand that healthcare workers are not here to make money. We're not in this industry to make profit. We are here for the mission. And all we're asking for is the very bare minimum. And I can tell you this, that we have unionized because staff were not getting paid their true value. We had staff that were working 2, 3 jobs, weren't able to afford their own care, weren't able to afford care at our own clinics, like the one here in Chula Vista. And we unionized because we deserve more than the $25 minimum that I think is actually a very fair position here. If anything, you should take it. Because if we don't get this, what is needed for so many workers within this industry, they're going to leave, or they're going to see unionizing as their next step. And you can be sure that they are going to ask for a lot more than a $25 minimum. And I can promise you that at Planned Parenthood and other health clinics across California, we are going to ask for more than that. So I would consider this as a compromise, as a solution that can stave off the loss of healthcare workers. And I think it's just one step in the right direction to valuing them as the essential heroes that we said they were during the pandemic. Thank you.
Our next speaker is Alexis Salazar, followed by Erica Rodriguez, followed by Kevin Matson.
Good evening. My name is Alex. I'm a medical assistant at Planned Parenthood. Before that, I was a CNA at post-acute and subacute skilled nursing facilities working throughout the pandemic with COVID patients. I stand before you to emphasize the critical importance of passing this ordinance. A measure that is both essential for staff like me, patients, and the community as a whole, and one that is long overdue. It is unacceptable that workers, the very individuals entrusted with providing necessary services, are unable to afford their basic needs. I have heard the go-to responses that were repeated over and over tonight. Work harder, work more, seek education to make your life better, have more merit, stop asking for handouts. I have a bachelor's degree, I have a master's degree, I have a couple certifications, I have a full-time job where I make $20 an hour, entry-level pay, and I have a part-time job. I'm also seeking continuing education to become a physician associate. All of that, and I live in low-income housing. I just applied for food stamps. It's actually a luxury now to have a bathroom, to have your own bathroom in a studio. I do not have one. And I constantly fear that something like a flat tire or unexpected health issues will push me into further economic distress. This is unacceptable, and it is the reality of so many people that are here and so many that are not, because we gave the executives the floor first. We are not asking for handouts. We are demanding to be able to meet our basic needs while doing the invaluable work that we do. The prevalence of wage theft and greed within the industry perpetuates this injustice that I've described. And by paying us subpar wages, these healthcare giants essentially rely on the taxpayers to subsidize their labor costs. How are they not the one asking for handouts by asking us to work for less? And the threat and fear-mongering that has gone on tonight, that clinics may close and access to care may be lost if we are paid more, is unethical and unacceptable. Such threats imply that these institutions prioritize profit over the well-being of patients and workers alike. We must recognize that not paying us livable wages is a significant contributor to the challenges our healthcare system faces. A lot of the people representing community clinics here mentioned how they serve the homeless, the people who need social services. I'm sure half of the people they're serving are their own workers. I encourage you to see us and to look at each of our faces, because this is my life. These are our lives that we're playing with here. It is time to end the exploitation, because that's what this is, and ensure that those that dedicate their lives to healing can also afford to live. I urge you to hear the voices that protect our patients on the front lines and support a $25 minimum livable wage. We cannot wait any longer to give workers this wage. Thank you for your time and consideration.
The next speaker is Erica Rodriguez, followed by Kevin Matson, followed by Michelle Krug. Erica Rodriguez? Kevin Matson?
I was just checking to see if I should say good morning or good evening.
Still evening.
Good evening, Honorable Mayor, City Council, and city staff. I want to start by recognizing the 2,700 employees of San Ysidro Health and all they do on a daily basis in support of the mission of San Ysidro Health, which is to improve the health and well-being of the communities we serve with access for all. We have about 650 of our employees live in Chula Vista. We serve about 26,000 citizens of Chula Vista. San Ysidro Health has a financially sustainable plan to get to a $25 an hour minimum wage over the next 18 months. The ordinance as written will be financially devastating to even San Ysidro Health. We cannot react as quick as the ordinance is drafted. I want to talk about a couple things. I don't want to get into the finance stuff. I want to talk about what's going on in healthcare. I want to read an email I got today from San Diego County Medical Society. Not the whole thing, just the first paragraph. Tri-City Medical Center is informing the public the following services encompassing women's and newborn services, OB, prenatal, postpartum, and neonatal ICU will be suspended effective September 30th. 96 people have been given the WARN Act that they will be laid off. Paradise Valley closed their labor and delivery unit on August 4th, 2021. We're lucky in Chula Vista to have 2 hospitals that serve the communities we serve, that take our patients. They lose money on prenatal care, everyone that comes in. I don't have studies from UC Berkeley. I don't have any of that stuff. I'm saying hospitals will close. It's proven. It's happening in Imperial Valley. It's happening in the Central Valley. Hospitals are struggling. We need places for our patients to go. And we're not talking about the patients. Do you really want our patients to have to drive up to Hillcrest or La Mesa or Kearney Mesa to deliver a baby when they're pregnant? Financial struggles in healthcare are real. I don't have studies. I don't have it. I know they're real. And hospitals are struggling. They're closing. They're shutting down. Look at communities. There's a number of, I think there's 5 hospitals. Tri-City just got a $33 million loan, interest-free loan from the state of California, and they're closing their L&D unit. They can't deliver babies up there. Those patients have to go to Encinitas, Scripps Mercy, Scripps Chula Vista, UCSD, or Rady Children's Hospital now from Oceanside. So think about the patients, think about your constituents and where they're going to get their health care if we have to start reducing services. That's all I ask. Thank you.
Our final speaker is Michelle Krug.
Good evening. I actually want to start with a point of personal privilege. Cristina Hernandez, I don't even know what her title is, but she just epitomizes awesome public service. She treated me, who had some challenges in figuring out where to go, etc., with kindness, patience, and authenticity. So I just wanted to say that. The situation at hand, I think it's interesting that all of the CEOs, the directors, the executives, the CFOs, all were able to come in early, put their slips in, and be out of here. For the most part, except for the gentleman that just finished, the workers are the people that had to come in after work and be here to tell their story, juggling the rest of their life. Just hearing the stories, having heard them before coming in tonight, I knew I needed to come down to urge you to please pass this. And when the question came up about how is this going to affect Chula Vista, I'll tell you how it'll affect Chula Vista. Maybe families or workers will be able to not worry about buying blueberries for their kids, actually being able to buy fresh vegetables and fruit, and not worry about whether they can afford a pound of cheese or cut it down to a half a pound. Maybe they'll be able to walk down a block and go to Onstage Playhouse, with their spouse or their kids, or go to a special dinner at Italianissimo for a birthday that they otherwise cannot afford. They might even go across the border to National City and get Niederfrank's one Sunday afternoon. It just amazes me how people of privilege who know that the CEOs are making 7, 8, 9, maybe even 10 figures in their salaries, are complaining about raising someone's wage to what is not even honestly a minimum, but it's better than what they have now, to be able to just barely survive. And it honestly hurts my heart that people are walking around feeling like that's okay to feel that way. So I just really urge you to please pass the $25 minimum, which is really below a minimum, to be able to survive. But I appreciate you having it on the agenda. I appreciate you staying so late and not rushing people and actually hearing them. So thank you.
That concludes our public speakers. I would like to announce for the record that we received 3 e-comments in support of the item and 3 emails in support of the item that have been distributed or emailed to council and are made available to the public.
Thank you very much. First, I want to thank all the speakers here. This was a very good input on both sides. I really appreciate everybody's ability to come and articulate what their side was. We'll go ahead and now, this is not an action item, but it is essentially a listening to give direction to the city manager or staff on what the next steps are. So I would ask the council, Member Cardenas, you're up.
First of all, I want to thank everyone that's here tonight, that took the time to come here. Every single person that spoke on this item. I know that it's not always easy to come to these meetings and to wait for your turn to speak, especially when I'm sure many of you have to get up tomorrow morning and work a full day. Over the past few weeks, I've had the opportunity to meet with stakeholders on every side of this issue. With some, I've met multiple times. And I want to say I pride myself on not assuming that people have malicious intent, something that isn't always wise in policymaking. But I do believe that some of the folks from our local hospital leaderships, they really do want to take care of their workers. However, I also do believe that our healthcare workers are struggling. And this goes beyond what we've just heard tonight. I've seen it firsthand. I'm the child of very sick parents, and at one point or another, I've entered every facility's emergency room in the city. I've interacted with not just the doctors and nurses at our local hospitals, but with all the folks that make those clinics whole. Having a father who depended on dialysis for 15 years, I knew the incredible loss these workers would see on a day-to-day basis. I know it was a loss for my dad. I can only assume it was deep for the folks that were taking care of them. I saw how limited their resources were and how they still worked tirelessly to provide treatment, the best treatment for my dad. And I'll say this, when I would talk to my dad when he got home from his treatments, he would go on and on talking to me about the transport workers, the receptionists, all the techs, and those were the people that he truly had an ability to bond with. Those are the people that encouraged him to stay in the fight and keep fighting for his health. I know that I have the immense privilege today to have my dad with me because of these amazing workers. I know that this is hard for everyone that's coming and talking about this, and I want to know that the people that really saved my father's life are able to get paid a fair wage, that they can afford to live in our community, and that they know that this city values them. I don't doubt that the hospitals in our city have good intentions, but Tonight, we have an opportunity to truly show our healthcare workers with more than just words how much they matter. With that being said, I really would like to ask for consensus to bring this back next week on first reading as it has been written. Or at our next meeting.
I support it. Yeah, I'd like to make a couple comments first, but Member Preciado or Member Gonzalez, do you have any comments?
I'd support bringing that for next week. I want to thank everybody who spoke tonight. I think we heard from a few sectors that I care about deeply. We heard about the healthcare providers, notably some of the clinics here in Chula Vista, and we care about their fiscal health as well as their opportunity to serve the patients and the healthcare workers, the healthcare providers as well as the staff. And I also should say that I care about the health of the labor unions. The labor movement as well is an important part of this ecosystem, and I'm pleased to say that that's part of the decision-making process for me, is making sure that we support having the labor union be and continue to be a strong presence in our community. That being said, I do support bringing this back. I do have a question from staff, if this is an appropriate time to ask if they could address the whole question of this possibly becoming a moot point, depending on how the Senate bill, which is now on the Assembly side, moves forward. In what sense can it be a moot point? And in what sense is it still critical or impactful if we move forward with this?
So the Senate bill as currently written has a provision that would void any local legislation that's passed after September 6th of 2003, which means that any ordinance you were to act on, if the state bill does pass, would be voided upon its passage. So we anticipate a floor vote on Thursday of this week, and then the governor would need to sign within 30 days, so by October 14th.
Thank you.
Any more questions or comments?
No, well, I will make a comment. I support bringing this back exactly as written a week from now, but I will make the point that I am sensitive to the idea that several speakers have raised on behalf of the healthcare providers that this does not provide any meaningful ramp-up period. Depending on where you look, it's 30 days or January, and I would be open to considering allowing them more time, or what are the pros and cons of that as part of the conversation. That being said, I look forward to hearing this as soon as the very next council meeting.
Thank you. Member Preciado?
So I'm going to be brief. This is, I think it's clear we're going to be discussing this on the 19th. So I just want to make a few points related to how I've been engaged in this issue. As early as May 30th, there was an announcement and public announcements made that a petition was circulating in this city, or was going to circulate in this city, for a $25 minimum wage for healthcare workers. I also want to make note that multiple steps had to be taken to get to the point where they could collect signatures. And I've seen signature gatherers everywhere. In fact, I've been going to that Costco line to get gas recently, and there they are. And so this is not something that just happened. This is something that is been underway in the city, and one of the things that I very much respect is the will of the voters in this city. They got us all here. They also help us shape policy, and I as far as I've been informed, they're in the trajectory to collect signatures. So one item that Senior Deputy Attorney McClurk can clear up for me is a local ordinance adopted by us, the same as a local ordinance adopted by the voters of this city.
The way the state legislation currently reads, yes, it would be any ordinance. So if a voter initiative comes by ordinance from the people, it would still be a local ordinance that would be voided under the state legislation as currently written.
Thank you so much. I think that's an important area to clarify. So one of the things that we started discovering when the petition started to, or the idea of a petition started, is that SB 525 was actually supported by State Senator Padilla when it left the State Senate back in, I believe it was May or June. And so we know that there are the systems of healthcare have been engaged at the statewide level in trying to reduce the impacts of this kind of legislation. And I too am very concerned about how fast we are proposing or thinking about proposing, but I look forward to the opportunity to see this at our next meeting. And secondly, I also look forward to continuing to meet with the stakeholders to think about areas, because I'm not completely sold that we shouldn't create some sort of runway that makes sense or at least mirrors some of the language that is being negotiated in Sacramento. And the last point that I'm going to make is, as people have been requesting that a fiscal analysis be undertaken to identify the impact, one of the things that is clear to me is many of us have not been able to step back a little bit and start thinking about the economics of the individual family members who participate in this industry and have to do a fiscal impact analysis every day. Every day you're going to make choices about how you're going to live. Every day you have to make choices about the kinds of decisions you have to make for your family at that kitchen table. And I'm hoping that as we move forward with this initiative, I don't know what is going to happen on September 19th, and then on to the second reading, potentially if it passes on September 19th, that second reading would be October 12th. I don't know what we're going to do then, but I really invite us to start thinking about the families that participate in this industry and the economic impact of not doing anything is on those particular families. And I appreciate all of you who have contributed to the conversation this evening. I hope we don't, whether this passes or doesn't pass, that we stay engaged. I'm very interested in looking to see how this city council can contribute to everyone's success. Thank you.
Thank you very much. I have such a admiration and respect for our frontline workers. My sister actually is a frontline healthcare worker, and for years I actually worked in the healthcare industry, not as a provider, but supporting our frontline workers. I've seen the ups, the downs, the good and the bad, all the way through COVID-19, the pandemic, and these people were just outstanding. And I can't say enough great things about our healthcare workers. The ordinance will have a substantial effect on both hospitals and health clinics. Health clinics that serve our most vulnerable, low-income residents in the city of Chula Vista. Costs do matter. Earlier this year, Chula Vista's Frederica Manor closed their nursing facility, leaving hundreds of healthcare folks without a job and many residents without healthcare services. I support a true independent economic analysis of the impacts of this ordinance, especially on health clinics that provide the services that are most needed for our most vulnerable low-income residents. With that, we'll go ahead and move forward. We do have 3 individuals who'd like to have this come for reading next council meeting, the 19th. And then Madam Clerk, do we need to take any action, or do we have just consensus?
Just consensus on that, no vote.
Okay, well, thank you very much. We will now move on to the next item,